In the same general area of Parkinson's disease, the next award went to Dr. Dan Johnstone, who's also from the University of Sydney. Dan, if you could, please.
So as Hayden just mentioned, one big problem that we currently face is that the treatments for Parkinson's disease, while they can be effective in relieving some of the signs and symptoms of disease, they do nothing to actually stop the disease from progressing. So after the last few years, our research group has been trialling various interventions for preventing the progression of this and other brain diseases, with a focus on approaches that are safe, non-invasive and simple to administer. And through this work, one of the most effective approaches we've come across is the irradiation of tissue with low-energy near-infrared light. In animal models of Parkinson's disease, we've shown that by applying near-infrared light to the outside of the skull, we can actually protect the brain against the damage associated with Parkinson's disease and also partially restore normal movement. But what's not clear about this treatment is exactly how it works. It's widely assumed that the light needs to be targeted directly at the damaged tissue, in this case the brain. But if this is actually true, it really limits the potential for the use of near-infrared light in the treatment of Parkinson's disease patients, the reason being that the light would need to penetrate the thick human skull and a large brain mass in order to reach the deep sites of the brain that are affected in this disease. So our measurements suggest that this isn't really a feasible option. And that's what makes the current project so important. Our recent work has shown that direct irradiation of the damaged tissue isn't actually required for neuroprotection. In fact, we've found that there's still protection of the brain even when the head is shielded and only the body of the animal is treated with light. So this project will investigate how near-infrared light, when targeted at a remote tissue, provides protection of the brain. And more specifically, we'll test a novel idea that light stimulates an increase in stem cells in the bone marrow, which are then released into the bloodstream and recruited specifically to sites of damage within the brain, where they can induce the repair of damaged nerve cells. If these indirect neuroprotective actions of near-infrared light are confirmed, then the problems associated with delivering light across the thick human skull and brain become irrelevant. So for this reason, we strongly believe this work has the potential to open up novel therapeutic avenues for Parkinson's disease and other diseases of the brain. On a personal note, this is actually my first national research grant, so it means a great deal not just for the development of this treatment, but also for my personal development as an independent scientist. So I offer my deepest thanks to the Brain Foundation for the faith they've shown in investing their valuable resources in this project, and also to all of the donors who make it possible. Thanks.